Hi everyone, this is Dr. Ankit Goyal, your psychiatry faculty at PrepLadder. And in this video, we're going to discuss some important disorders of thought. And we are going to discuss it from the rapid revision notes, which are in the Q&E format, which helps in active learning and also helps us understand things in a much easier and simpler manner. So let's talk about the disorders of thought. So the broad question is, what are the different types of disorders of thought and their clinical features with examples? Now, the disorders of thought we have divided into four domains. The first is the disorders of flow or stream. So you can imagine it like this, just like a river is flowing, so water is flowing in the river. Similarly, if you sit silently, you will observe that the thoughts are flowing in our mind. So one problem is the disorders of flow or stream, which we are going to discuss. Second is the disorder of content of thought. So content of thought means that whatever the person is thinking, there is problem in the content of that thought. And one important abnormality included under the content is delusion. Third is disorders of form. So you can understand it like this. Form means shape or structure. Just like this pen which I'm holding, it has a form, it has a structure. Similarly, our thoughts also have a form, or we can say that our thoughts have organization. So our thoughts are organized. And when there is abnormality of form, that is known as formal thought disorder. So in formal thought disorders, there is disorganization in the thought. Some examples of formal thought disorders include such as loosening of association, tangentiality, derailment, neologism. And many of these formal thought disorders can be seen in schizophrenia. And number four is disorders of possession of thought. So again, you can understand it from the name. Possession means, again, if I ask you that the thoughts coming in your mind are your thoughts or your neighbor's thought, you will say, of course, sir, we possess our thought. So normally we experience that our thoughts are under our possession and we also have a control over it. But when there is abnormality of this, we call it as disorders of possession of thought. So in disorders of possession, an important abnormality is obsession, where the person is not able to control the thoughts are occurring repeatedly. And also one more abnormality is thought alienation. Again, you can see from the name itself, thought alienation. The thoughts are not mine, so they're alien. They are under someone else's possession. So these are the four broad categories in which we have divided the disorders of thought. So let's discuss some detailed question. So the next question is, what are the components of the flow or stream of thought? So as we discussed, just like water is flowing in the river, our thoughts are also flowing. So this abnormality of flow can be of two types. One abnormality is the disorders of speed or tempo. So there is one problem in the speed of the flow. And another abnormality is the disorders of continuity. That means the thoughts are not flowing continuously. So let's discuss the disorders of speed or tempo. Again, you can appreciate the speed can be abnormal in two ways. So the speed can be either increased. So that means the thoughts are flowing very fast. One thought, second thought, fourth, fifth, sixth thoughts are coming very fast. So you can understand the speech will also become fast. While there can be decrease in the speed, so the thoughts are flowing very slowly. So let's discuss the abnormality in the increased speed. So in the increased speed, first abnormality which we are going to discuss, very important, is flight of ideas. Again, I always say, try to just see the name and you'll understand the concept. So always, try to understand things from the name and you'll never forget. So what is flight of ideas? The name is telling you as if the ideas are on a flight. So in flight of ideas, the thoughts follow each other rapidly. Suppose I ask a patient with flight of ideas a question. So the thoughts are coming very fast in his mind. So the patient may start speaking something and he'll speak very fast. And he will speak things which may not make much sense. It may be, illogical at times. And ultimately, he will not answer back my question. So I'll say that the goal is not reached in flight of ideas. Now, although the patient is speaking very fast, the thoughts are coming very fast, the speech may not make much sense, but when you hear that speech, you'll see there is some connection in the thoughts. So let's understand what kind of connections can be present. So the thoughts may be connected either by a chance factor. So there may be some by chance connection between the thought. For example, let us say a patient is speaking like this. So he's speaking very fast. Let me slow it down for you. So patient speaks like this. My name is Virat. I like playing cricket. Cricket is a game of gentlemen. Gentleman is my friend Mukesh. Mukesh smokes cigarette. Cigarette causes cancer. Cancer is my zodiac sign. So can you appreciate one thought is connected by a chance factor. So this is flight of ideas. For example, ये मौसम की बारिश, ये बारिश का पानी, ये पानी की बूंदे तुझे तो तूने, something like this. So this is by chance connection. And sometimes the thought may be connected by what is known as clang association, or there may be rhyming words. So patient may speak like this. Ram can sing, birds have wing, I am the king, phone goes tring tring, the weather is spring, bring 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 bring. So again you can see nothing is making much sense, but the thoughts are connected by rhyming. So this can be seen in flight of ideas. Now also one important question which is sometimes asked, that where do we see flight of ideas? One important condition you should remember, flight of ideas can be seen in mania. In fact, when we discuss mania, we discuss a mnemonic me, dig, fast, and in that fast, F is flight of ideas. So it can be seen in mania. In other conditions also it can be seen, such as it can be seen even in schizophrenia and even in organic mental disorder. But remember, if one condition asked, remember mania. So here, flight of ideas, the speed is increased. Let's discuss one more abnormality in which the speed is increased. So second is prolixity. Now in prolixity also, the speed is increased, but it is less than flight of ideas. So thoughts are moving fast, but their speed is less than flight of ideas, or sometimes it is also known as ordered flight of ideas. So there is some degree of orderliness in prolixity as compared to flight of ideas. So again in prolixity, the patient speaks fast, and again the patient may speak things which may not make much sense, but ultimately he would answer back my question. So here we say that the goal is reached. Now one important condition you can remember where prolixity can be seen. Now again, don't bug up things, let's apply some logic. So we are saying that in flight of ideas, the speed is high, it is seen in mania. So prolixity, we are saying it is ordered flight of ideas, the speed is slightly less than flight of ideas. So it is seen in a condition which is less severe than mania. So remember, it can be seen in hypomania. So these are two important conditions you can remember where the speed is increased. Now let's talk about some conditions in which the speed is decreased. Now when we talk about decreased, that means the thoughts are coming slowly. So one condition is retardation. So there is retardation of thinking, the speed is decreased. So the speech, you will also see that the patient may speak slowly. So again, it can be seen in conditions such as depression. In depression, we know that the mood is low, energy levels are low. Even you'll see that the speech may also have decreased rate. So this is retardation. Another important entity, remember, is circumstantiality. Now, what is the meaning of circumstantial? The person is giving unnecessary information. So circumstantiality, the thoughts proceed slowly, the speed is reduced. Very important to remember is that the person would give unnecessary or trivial information. Those details the patient would give which you have not asked for. It may be making sense, but these are unnecessary. You're not asked for those details. Even those details, trivial information the person would give you. And ultimately, the patient would answer back your question. So we say that the goal is reached. So this is circumstantiality. For example, somebody wants to go from A to B. Rather than going straight, the person is going like this. So this is circumstantiality. Again, it can be seen in many conditions like schizophrenia. Even sometimes in anxiety disorder, you may find this. So these are abnormalities of the speed or the tempo. Now, for example, let's ask this patient, who is your favorite actress? So patient with circumstantiality, I've asked, who is your favorite actress? The patient starts like this. Alia Bhatt acts very well. I have seen all her movies. I was upset for a few days when I heard she's getting married, but may God bless her. Even Katrina Kaif, dances very well, acts well. I've seen most of her movies. I was upset for a few days when I heard she's getting married, but may God bless her. Even Kareena Kapoor is a wonderful actress. I was upset when I heard she's getting married, but may God bless her. My favorite actress is Kiara Advani. So can you appreciate? You asked favorite actors. The person is giving unnecessary information and ultimately he's reaching the goal. So this is circumstantiality. We'll take up some MCQs also in the end of this video so that we understand these concepts in a much simplified manner. Now let's talk about the second abnormality. So what are the types of continuity of thought. So let's discuss some abnormalities of continuity. So remember, we discussed that the flow or stream is divided. One was the speed and another was continuity. So that means that the thoughts which are flowing, the problem is in the continuity of the thought. So one important abnormality under this is perseveration. Again, important. Now see, what is the English meaning of perseverating, or somebody is persevering? So perseveration basically means doing something again and again. So remember 3 P's. P for perseveration. Remember, P for a thought persists beyond the point of relevance. So in the mind of the patient, there is one thought which is persisting again and again, beyond the point that it is not relevant anymore. So this is perseveration. So person may be answering all the questions with the same words. This is perseveration. For example, you ask a patient, what is your name? Patient says, my name is Mukesh. It is correct. It is relevant here. What do you do? My name is Mukesh. Where do you live? My name is Mukesh. What is the name of your wife? My name is Mukesh. So now can you appreciate here? He's answering all these questions with the same answer. Now this thought is not relevant, but it is persisting beyond the point of relevance. So just appreciate it like this, as if the person is stuck at one thought. He's not able to move further. So there is problem of continuity of thought. Now 2 important conditions you can remember in which perseveration may be seen. Number 1, very important, is organic mental disorder. So in organic mental disorder, there may be perseveration. And second condition you can remember is schizophrenia. Schizophrenia is a psychotic illness. Again, there also sometimes perseveration may be seen. Now let's discuss another abnormality. So two abnormalities under each of these categories we are discussing. So next, under continuity, is thought block. So again, just see the name. The name is telling you there is a block in the thinking. So here what is happening, that there is a sudden arrest of thought. So person is talking about a topic and suddenly there is a pause in his thinking. Suddenly there is a block. And after some moment, the person may start talking again with an entirely new topic. So person begins with an entirely new topic and these two topics may not have any connection. And the person will not be able to explain what happened during this block, why he has come to the new topic. So this is thought block. So again, can you appreciate? There is a block in the thinking. For example, we are discussing about the daily routine of the patient and the patient says, sir, I woke up in the morning at 5 o'clock. I went for a run. I came back. I took a shower. Then I started preparing my meal and suddenly there was a pause in his thinking. And after, some moment, the person starts again talking and starts saying, sir, there is Asia Cup going on. I wish, India wins this, and subsequently further. So can you see any connection between these two thoughts? No. And he'll not be able to explain what happened during this block, why he shifted to this new topic. So this is thought block. Again, remember, it can be seen in conditions such as schizophrenia. So these were some important abnormalities of the flow or stream of thought. Now let's take up some MCQs so that we are able to again correlate our knowledge and apply this knowledge to solve MCQs. A doctor asks a patient about the age and the patient responds, doctor, I am from a village. We were married at a very young age at 12 with my husband who is just 5 years older than me. Then I had 2 kids when I was around 18 or something. Now I am 38 but look like their older sister now. What is the most likely thought disorder displayed by the patient? Now can you appreciate, we asked a question, what is the age? The patient started talking. And when the person is talking, you can appreciate that things are making sense, but the person is giving so much unnecessary trivial information. But is the patient ultimately answering our question? Yes, ultimately she answers the question. So the options are, is it circumstantiality, tangentiality, derailment, flight of ideas? Now let's understand this. In flight of ideas also the patient may speak a lot of things. Here, first importantly you'll say, sir, speed is not mentioned. But still, if you differentiate in flight of ideas, even if the speed is not mentioned, you'll see that the person is talking things which may not make much sense and you'll see some correction. But here, when you look at the speech here, everything is making sense. So it is not flight of ideas. Now, tangentiality and derailment, these are abnormalities of form of thought. I always say remember things from the name. So see here, derailment. What is derailment? A train is moving on track and suddenly it gets derailed. So this is derailment. So what happens in derailment? While talking on a topic, after some time the person may go to a new topic. And again, there may not be any connection between these two thoughts. So this is derailment. How will you differentiate it from thought block? In thought block also you'll say, sir, after some time the person may shift to a new topic. But remember, thought block is an abnormality of continuity. There is a pause, there is a arrest of thought, and after that the person goes to a new topic. While in derailment, while talking on a topic, suddenly the person changes the topic. So that is derailment. In tangentiality, again see the name itself. What is a tangent to a circle? So tangent to a circle, it's a line which touches the circle at one point and goes forward. Does a tangent comes back to the circle? No. In tangentiality, from the beginning, the patient just touches the topic and goes away and does not answer back your question. So the goal is not reached. So please remember, in tangentiality, the goal is not reached. While in circumstantiality, the person is giving unnecessary, trivial information, but ultimately is answering your question. So here, the right answer is, it is A, circumstantiality. Let's discuss the next question. A patient says, I am a lawyer, call my doctor because you are a liar. He is umpire. Don't touch that wire. It's hot, hot like today's sun. Oh, my son is Mohan. Which of the following is seen? So options are loosening of association, flight of ideas, derailment, perseveration. Now perseveration, it is not perseveration, as you can see. It is not derailment. Again, see, nothing is making much sense. So loosening of association, again, it's an abnormality of form. Again, remember, sometimes you'll see loosening of association also, you're not able to understand anything. So there is the breakage, or there is breakdown in the logical connection between the thought. Now, one important difference between loosening of association and flight of ideas is speed. But here again, in the written speech, when they have not mentioned, you'll not be able to tell what is the speed. But see, in loosening of association, patient may be saying things which are not making much sense. But what is the difference between loosening of association and flight of ideas? In flight of ideas, we have discussed there will be some connection, like for example, by chance connection, or there may be some clang association. Such connection may be seen. Like in this case, you can see there are certain connection. I am a lawyer, you are a liar, he's umpire, don't touch that wire. So you can see certain connections. So here again, the answer is flight of ideas. Now sometimes there may be two options which may be difficult to differentiate, but if you know the basics well, you'll be able to differentiate between these two options. Let's discuss one more question. A 65-year-old male is brought to you by his wife as she has noted some personality change in the past few months. Now, while the patient is being interviewed, he answers every question with the same words. Which symptom best fits this patient's behavior? So the options are, is it circumstantiality, B, perseveration, C, delusion, or is it D, flight of ideas? Of course, you'll say, sir, it is not flight of ideas, it is not circumstantiality. Now, what is delusion? Delusion is an abnormality of content of thought. In this, person has a false, fixed, firm idea or belief which he is holding with extraordinary conviction. So again, delusion such as delusion of persecution. Patient thinks somebody wants to harm me or somebody wants to kill me. So again, it is not delusion. Here we have discussed it is perseveration. He is repeating the same words in every question. So this is from the option, it is perseveration. So these were some important abnormalities of flow or stream of thought. So I hope you enjoyed this and you can continue your revision with the rapid revision notes. So again, this is about this video. Thank you very much. Keep smiling, keep moving forward.